Hi, I'm Shreya Jhawar, a clinical psychologist associate and an expressive art therapist. If you wish to know how the first therapy session would look like with me, firstly, I'll introduce myself, talk about my education, experience, and expertise. Then we'll talk about consent and confidentiality and the exceptions to confidentiality. Then we'll talk about a little about the logistics, the fee, the availability, and the frequency of the sessions. I'll also set the guidelines for the space, explain how therapy is different from having a medicine, explain your role in therapy and how important it is for you to be actively involved, because ultimately therapy is about your life and you are the expert to your life. Then we'll unravel the most important question: what brings you here? We'll slowly understand the details of what has been happening to you, how long it has been happening, understand the problem in a biopsychosocial model, understand all that is hampering in your daily functioning, understand the things that you're able to do or the things that you're not able to do because of all that you're feeling or you're going through. Then we'll also talk about your history, the childhood, the birthing, your friends, your family, school, academics, relationships, marriage, a lot in detail. We'll take a detailed understanding of your physical, your neurological, and your psychological mental history. We'll also talk a lot in detail about the family history, the family dynamics, what is your relationship with the family members, how is the relationship between the family members. After understanding your scenario in your perspective, we then go on to understanding your goals for the therapy. What are your expectations out of it? And what your goals are in terms of long-term and short-term goals. And then finally, probably explain the prognosis for therapy and maybe make a guideline of how therapy would look like or how the progress would look like in the coming few sessions. If you need to know more, please read the caption and contact us for more detail.